A sudden sharp pain in your abdomen. It can be more than just some gastric issue. And if the pain is in your lower abdomen or around your navel, guess what? It can actually be appendicitis. Hi, I'm Dr. Preeti. Let's find out what appendicitis means and what are the treatment options that are available to treat appendicitis. So, appendix is basically a small tubular structure that's attached to your large intestine. And this can get infected pretty easily. Sometimes it can get filled with pus, sometimes only the tip can get enlarged, or sometimes even what we call a fecolith or an appendicolith can get deposited into the appendix, thereby causing various complications associated with appendicitis. Appendicitis basically occurs because of infection. It can rarely cause cancer. First, let's look into the symptoms that we have to watch out for. So, the primary symptom is a sharp, sudden pain that can first occur at the navel and then slowly progress into the right side of your lower abdomen. Think of it like a punch in the gut. That's how it literally feels. Next is nausea and vomiting. Not always will you have vomiting, sometimes it might just stop with a nauseating feeling. So, this is your sign saying, please look into it at the earliest. Loss of appetite. You might not really be feeling hungry, or you might not feel like having any sort of food, mainly because of the nauseating feeling. Fevers and chills. These are signs that the infection is brewing. Abdominal tenderness. This is something that's elicited on palpation, that is on touch. So when you touch the lower right side of your abdomen, you might feel that it's a little tender to touch and you might feel a sharp pain again. If you or someone you know are experiencing these kind of symptoms, it's very important to address it at the earliest. Diagnosing appendicitis. Appendicitis is more often a clinical diagnosis rather than a radiological diagnosis. What I mean by that is your doctor will be able to palpate your abdomen and tell you if this looks or seems like appendicitis. So once they think that there can be a diagnosis of appendicitis, they might resort you to further blood tests and ultrasound investigation. Now, when you blood test, what do we look out for? There might be a rise in WBCs, that is your white blood cells, basically responsible for your immunity. So they might be very high or even slightly increased if there is infection in your blood. So that proves that you have some sort of infection. When we do an ultrasound investigation, more often, we might not be able to visualize the appendix. If that is the case, then we will resort you to a CT abdomen. And once a CT is done, the appendix might be visualized where it shows an inflamed tip or confirming your appendicitis diagnosis. So, treatment options. There is no medical treatment for appendicitis. First, we need to understand that appendicitis can be classified into subacute, acute, and chronic. So, subacute is something which is experienced by certain individuals who have appendicitis, but the severity is not much. And next, we move on into acute. Acute meaning it is a very acute episode, and the pain is pretty severe, and it needs to be addressed at the earliest. Chronic meaning few patients just let it be for a long duration and thereby they live on with the pain, meaning the pain is not much. They just try and live with the pain. So that is called chronic. And there are other conditions like acute on chronic and etc. etc. But the treatment option is laparoscopic appendicectomy. So that is surgical treatment is the only option to address appendicitis. Now this procedure can be done laparoscopically or via minimal access. That's again very small incisions through your abdomen. Once again, the benefits of laparoscopic surgery is again minimal scars, speedy recovery, and lesser rate of infection post-operatively, and quicker return to your work. Laparoscopic appendicectomy is the preferred choice of treatment and it has been the most recommended procedure for any sort of appendicitis. How is the recovery? So, post surgery, the recovery is pretty quick. The patient will be able to walk and be on his feet the very same day after surgery. After a week after surgery, he will be able to go back to his work and his day to day